All right, everyone. Hi, it is 12 o'clock Eastern Time, and it is time for our Zone 33, 34, and more call for Monday, June the 1st. Welcome to all, and thank you for joining us today. Before we get into our program for the day, you all know that we received sad news last week about the death of Rotary International past president Frank Devlin. So additionally, we had a tough week as we watched the aftermath of the senseless murder of George Floyd. So I hope that you will just join me in a moment of silence for Frank and for George and for all others who have been victims of hatred. Thank you so much. All right, and now I'm going to ask Director-elect Peter if he will introduce our very special cameo guest for today. Peter?
Thank you, Stephanie, and good afternoon, everyone. It's my really great pleasure to introduce Dr. Ann Matthews. If there's anybody in our two zones who does not need an introduction or who does not know Ann Matthews, then you must have been living on another planet. Ann is a past director of our two zones, a past trustee, a past Rotary International Vice President, as David mentioned. I doubt that there are many committees or positions within the Rotary world that Ann has not occupied or served on. I've had the pleasure of working with her on several committees. She is an icon within our part of the world. Rather than cut into her time and tell you more about her illustrious record, I'm going to stop and simply pass over and extend on your behalf a very warm welcome to Dr. Ann Matthews. Ann, please.
Thank you, Peter. Can you hear me okay? Everybody? Good, good. Thank you for inviting me to be with you today. I really appreciate this opportunity, and it's so nice to see so many friends on this Zoom meeting today. What in the world did we do before Zoom came about? I tell you, many of us have 3 to 4 to 5 Zoom meetings a day, and it is a good way to communicate. When Stephanie asked me to speak, she said, Ann, you can talk on anything you want to for about 5 minutes. So I choose to talk on the Rotary Foundation. Many of you who have heard me speak or know me personally know that I am for and about the Rotary Foundation. I firmly believe that it is our projects, it is our programs, our grants, our community initiatives, our scholarships. Those are the things that have given Rotary its reputation of credibility, respect, and integrity in the world. This year, I'm serving, and I want to briefly touch on 2 committees. I chair what we call the BEL Committee, the Basic Education and Literacy Major Initiatives Committee, and also the Polio Advocacy Committee for the United States. And I want to touch on each one of those quickly. I am an educator by profession, so I care deeply about the children in the world because they are our future. And I've worked on this committee now for 3 years, and our goal overall was to raise $25 million. And we were to go after donations in excess of $25,000. But as you know, we take any amount of money. It can be 500 or 5,000, we'll take it. But we had a goal of raising 25 million, and I think we're supposed to reach that goal by next year. Well, we reached it last year, which was wonderful, and I'm real proud of that. My committee has worked very hard. It's not just Ann Matthews, it's a committee of 5 or 6 people. But guess what the trustees did? Now that we reached that goal, they've given us a new goal of $40 million for the next 5 years. So that's going to be a tough one to reach, but I think we can do it. I wanted to share with you something personal. because I've now been able to travel, as many as you have, in 70 some countries, doing humanitarian work and educational work. I did a lot of educational work in countries before I became so heavily involved in Rotary. But I particularly am fond of the country of Ghana. And several years ago, I went there the first time with Walter Hughes, and many of you know Walter from Virginia. I fell in love with the Ghanaians. They were so poor, they still are so poor. And my heart just ached because the children did not have decent schoolroom, classrooms, didn't have equipment, any of those things that we take for granted every day. And I had a dream that we would build a school in Ghana, an elementary school. Well, working with a lot of people, we raised a lot of money. And 2 years ago, I went back, I think that was the 4th trip, and we broke ground on an elementary school. The trustees had said we could build a simple school. Thank goodness they made that decision. So they built the school, and then we went back this last fall, and it's a beautiful elementary school. It's 6 rooms, it has computers, it has solar panels, it has beautiful desks and chairs for the children, and it has water sanitation system, plus for the first time it has an all-male bathroom and an all-female bathroom. And it's just a beautiful sight to see. That is because of the Rotary Foundation. It's because of the districts who believe in educating children in all over the world, and particularly in those developing countries. So people on this Zoom today, there's several of you who were there with me. Walter, Amber, April, Peter, Colleen, Sue, Beth, David, Michaud, just a lot of you. So I have to thank you for helping us to build that school in the Tame district. And I hope to go back when we're able to travel again and see how it's working. The second one, and which is so important, and I'm so glad to see John German here today, and he can correct me if I say anything that is not exactly right, but I do chair the committee that is the Polio Advocacy Committee to eradicate polio for the United States. Jim Lacey chaired this. He was the president of Rotary International. I was his vice chair. He was a wonderful chair. And I learned a lot from Jim Lacey. And so I took this over a couple of years ago. And my committee and I, we go to Washington 4 or 5 times a year. And we bring Congress, men and women, up to date on the progress that's been made with polio. And we thank them for their leadership. We thank them for the money that they have given us. And I want to say this up front today, that polio is neutral. It's a nonpartisan effort. It is broad bipartisan support. We get support from Republicans, Democrats, Independents, and we do not go in there and talk about any particular party. We just thank them for the support. And on some occasions, on one occasion, I did ask for more money. I'm that kind of person. I'm pretty good at asking for money. And a couple of years ago, 3 years ago, whatever, we did get a few more millions to help us eradicate polio. Very quickly, let me say that we get from our government $237 million a year. 176 million that goes to CDC, 61 million that goes to USAID, and some of those funds go on to WHO and UNICEF. You might want to know that overall, and John may know the specific figure, that we have invested over $16 billion to eradicate polio in the world. Our government, this is important, the latest figure that I got is our government has contributed $3.7 billion of that money. And the Rotarians and Bill Gates have given $2.1 billion. We've immunized over 3 billion children, and just stop and think about that for a minute. There's 3 billion children that won't be crippled, that won't die from that dreadful crippling disease. And I have to say thank you to all of you who are on this Zoom today and the many Rotarians across the world. This is our top priority. It is #1 with us. And based on the information I have, we've now donated about 37 million. We need to reach that 50 million before the end of June so that Gates will double that money and give us 100 million. I love what I do when I go to Washington. I've established relationships with staff members in many of those offices. I can pick up that phone. I do pick up that phone because I know people personally, and I can get a quick response and so forth. I'm thankful that the trustees allow me to serve in that particular role. I know Carol Pandak is your speaker today, and she is a fountain of knowledge on polio and knows so much more than I ever thought about. And she can correct me on anything that I may have erred in saying. Let me end by telling you something very personal. I am not a braggart. I want to say that up front. And those of you who know me know that I'm not. But I believe so strongly in our foundation and what it's done and what it can do. And I was in a club speaking back in November. And I was talking about all the things that the foundation does. I address water, sanitation, poverty, hunger, maternal health, polio, all of those things. And at the end of that session that day, a gentleman walked up to me. And I want you to listen to this. This is the truth. That gentleman said to me, Ann, I did not know our foundation did all those things. And I said, yes, sir, it does. I said, those things that I've talked about in here today are things I have experienced firsthand. That is what the Rotary Foundation does. It makes a difference in the lives of people who cannot help themselves. And he said to me, well, I'm going to give some money to the foundation. I thanked him. I went on my way, came on back to Columbia. The next week, I got a phone call. And the president of that club said, Ann, I want you to come back down here. And I said, okay. And I did. And I met with that gentleman and his wife. And ladies and gentlemen, he wrote a check for $1 million to the Rotary Foundation. And he said, I want this to make a difference in the lives of those people that you talked about. What am I saying? I'm saying that when you speak to people, tell the story like it is. Be passionate, speak from the heart, and not necessarily from the head, and it works. I've enjoyed being with you, Stephanie. I hope I didn't go over too much.
So, Anne, you didn't go over 1 second. I think we could all sit and listen to you talk for much, much longer. Wonderful presentation. We loved your personal thoughts. We loved hearing about your work in Ghana, and particularly about your work with polio. I've had the pleasure of being with Anne on many occasions. Every year there's a reception in Congress to thank the senators and congressmen who support the polio eradication effort. Anne is always there. John Germ is always there. Between them, they do a remarkable job. So we thank you very much, Anne, not only for your presentation today, but for all the great work that you're doing on Rotary's behalf. And with that, I pass the baton back to Stephanie.
Thank you, Peter. Ann Matthews, you are simply awesome. Your comments remind us that we unite and take action to create lasting change, and that's why we're Rotarians. So thank you so much for sharing your thoughts with us today. Before I introduce our program, I do want to officially welcome past Rotary International President John Germ. You've heard he's on our call. Thank you for being with us today, John. And we also have 2 other past Rotary International directors, David Roper and Bob Menconi. Gentlemen, thank you so much for joining us. Now it's my pleasure to introduce our program for today. And our program is Dr. Carol Pandak, who's going to tell us a bit about polio and the pandemic. Most of you know that Carol is the director of Rotary's Polio Plus program, and she has been dealing and has been on the front lines of our polio eradication effort forever. Carol, I can't remember how many years, but it just seems like as long as I've been in Rotary, you've been there helping us move forward with polio eradication. So I will now turn it over to you, and please share with us information about polio and the pandemic.
Thank you very much, Stephanie. I'm so pleased to be here today. And Ann Matthews, I want to recognize your leadership on U.S. advocacy. It's absolutely extraordinary, the level of commitment you've been able to maintain from the U.S. government. So I wanted to thank you for your remarks today. So I'm going to give an update on Polio Plus within the context of the COVID pandemic. Just as a reminder, Rotary is a member of the Global Polio Eradication Initiative. In fact, we are a founding member of this initiative. It was founded in 1988, 3 years after Rotary launched our Polio Plus program. And it included the World Health Organization, UNICEF, the U.S. Centers for Disease Control and Prevention, and Rotary. In 2007, the Gates Foundation joined when they made their first commitment of $100 million to Rotary. And in December of 2019, Gavi, the Vaccine Alliance, joined our partnership. The Global Polio Eradication Initiative was launched when the World Health Assembly adopted the resolution to eradicate polio. Next slide, please. What I'm going to talk about today is the infrastructure of the Polio Eradication Initiative and how that has helped with the COVID-19 response. But there's really two elements to the infrastructure of the Polio Eradication Initiative. One is the effort to immunize all children under the age of 5 with the oral polio vaccine. So every year, Rotary and its partners and governments are immunizing up to 400 million children. And this requires frontline healthcare workers to go house to house, mosque to mosque, market to market, to find every child under the age of 5. And this is done multiple times during the year. In addition to the frontline vaccinators, the hundreds and thousands of those, we have hundreds of thousands of community mobilizers. These are women in communities who, in between the immunization campaigns, are meeting with families to talk about the benefits of immunization and other health interventions. In addition to these frontline healthcare workers and community mobilizers, there are tens of thousands of medical officers who are bringing their technical expertise to the initiative. So on one hand, we've got the frontline healthcare workers looking for the children, looking to vaccinate the 400 million children every year. And this is supported by the Global Polio Laboratory Network. This is a network that Rotary has helped to build of 146 laboratories around the world that are specialized in detecting the polio virus. Now, this requires thousands of surveillance medical officers to go out to the field when they hear of a possible case of polio, to take a sample and bring it to the laboratory for testing. And this, of course, requires thousands of laboratory technicians. What they're testing is the stool specimens of children, but also testing sewage water because the polio virus can live for a short period of time in sewage water. So this is the second part, I'd say, of the infrastructure of the Global Polio Eradication Initiative. And this infrastructure has helped us make tremendous progress in their fight against polio. In 1988, when the Global Polio Eradication Initiative was launched, there were 350,000 cases of polio every year in 125 countries. In 2019, only 2 countries continue to report polio. That's Pakistan and Afghanistan. And you can see Nigeria is a little bit different color. It's not red anymore. And that's because they have not detected a case of polio since August of 2016. And that entire region is on track to be certified polio-free sometime this year. So this is a picture, it's a little bit old, but this is a map of the COVID pandemic. And it reminds us of the map of the early days of the Global Polio Eradication Initiative, where there was virus all over the world. Next. So because the Global Polio Eradication Initiative has such a large global health footprint, those hundreds of thousands of frontline healthcare workers, they have also been helping to address the COVID-19 pandemic. And they're doing this with the skills that they have learned through working on polio eradication. So what exactly are they doing? I talked about the surveillance medical officers that go out to look for cases of polio. And when they find a potential case of polio, they not only take a specimen from the person who is exhibiting symptoms of polio, but also from people surrounding that person, so you can tell whether or not the virus is spreading. That same contact tracing is going on in COVID-19. The surveillance medical officers and other medical officers are training the frontline healthcare workers. We're investigating cases of COVID. We're educating communities. All of those frontline healthcare workers that we talked about are helping to educate communities about the benefits of hand washing and hygiene, and also coordinating outbreak response. When a COVID case or cases are found, how does the medical community intervene? And this is all being done based on what we've learned in the Global Polio Eradication Initiative. Next. So here are some concrete examples of how the polio infrastructure is being used to support COVID-19. So I talked about the global.
Mary Jo, you need to finish your table thing up.
Oh, okay. Forgot about that.
I wonder if people could go on mute if they're not speaking. Thank you. The Global Polio Laboratory Network, the 146 laboratories, is now testing both for COVID and for polio. There is a call center in Pakistan that was set up to take calls for suspected cases of polio. Parents could call in to say, my child is exhibiting symptoms, or you could tell the person on the other end of the line that the vaccinator had not yet been to your house. They are now taking calls for COVID. And I understand since the beginning of the response in Pakistan, they've taken over 70,000 calls to help parents and community members know where to go if they have COVID, or to answer any questions they may have. The community mobilizers that I talked about, again, are helping to talk about COVID prevention and the practices that are needed to stay safe from both polio and COVID. And then also in Pakistan, the logistics officers who were responsible for making sure that the polio vaccine got into all the communities where it needed to go are also now helping with the logistic distribution of personal protection equipment. So not only is the global polio eradication infrastructure helping on COVID-19, our Rotarians who are on the front lines of polio eradication are also working on COVID and polio. So for example, again in Pakistan, the vaccine coolers that Rotary provided that have the End Polio Now logo on the side are being used to transport COVID samples. In Pakistan, again, we partner with small NGOs out in the far-flung areas of the country, and these NGOs are now working on both polio and COVID. In Nigeria and Pakistan, they've distributed food rations. This is a photo here from Nigeria. Providing personal protection equipment in Pakistan, they've actually branded it with the End Polio Now logo, so people in the community know where these goods are coming from. And then in India, Rotary established an ulama committee, which is a group of religious leaders to talk about polio eradication with their constituencies. And this group is now also talking about COVID and keeping safe from COVID. So at the end of January, the Polio Oversight Board, which has representatives from all the organizations that I showed earlier, and Mike McGovern is our representative on the Polio Oversight Board, took a very, very difficult decision to temporarily pause immunization campaigns in order to protect frontline healthcare workers and communities from the spread of COVID, because we know that social distancing is one of the key strategies for stopping the spread of COVID. So while there's been a temporary pause in campaigns, much work continues on polio eradication. So surveillance for polio virus continues, routine immunization in clinics continues, so parents can bring their children to be immunized. We are working to ensure that the vaccine supply is fully and readily available when we do begin campaigns again. We're providing some additional services in communities, especially in Afghanistan. there's been a great project of delivering bars of soap and the baby blankets in the Taliban-held areas of some of the provinces. And it's interesting that the Taliban has reached out to the Global Polio Eradication Initiative in Afghanistan, seeking help for their response to COVID and to protect their communities. And then again, we're being sure to be prepared when we're able to undertake activities again. And I'm pleased to report that plans now are underway and guidance is being developed in order to help countries determine when it will be safe to start immunization campaigns again. So as I said, excuse me, polio work continues. Many of you may not know that even before COVID was declared a public health emergency of international concern, polio was also and it remains a public health emergency of international concern, which requires countries to report any possible case of polio to the World Health Organization. As Anne has mentioned, our advocacy work with donor governments such as the US continues unabated. And we see that global health has been prioritized. Canada just made an announcement of funding, a multi-year commitment for funding. Germany is operationalizing their commitment made, and the US government continues to be very, very supportive. Our fundraising efforts continue, and I want to recognize past President John Germ, who's on the call with us today, and his leadership in helping to reach our $50 million goal so that we fully leverage the Gates Foundation match. Rotary's been working hard also to share with the media how the polio infrastructure is supporting the COVID-19 response and talk about some of the similarities between COVID-19 and polio, which I'll talk about in a little bit. And then Rotary's International Polio Plus Committee, as scheduled, will meet on June 5th. So the bottom line and call to action. I think every Rotary member can be proud that the infrastructure that we have helped to build for polio eradication is helping to support the COVID-19 response. And we've done this in the past. The polio infrastructure in Nigeria helped stop the spread of Ebola within 3 months. The infrastructure has helped with yellow fever, SARS, avian flu, because, as I said, we have one of the largest global health footprints in the world. I think COVID-19 pandemic reminds us of the polio epidemics. You know, at the time of the height of the polio epidemics, there was not a vaccine, and we don't have a vaccine for COVID. The isolation or social distancing is the same for COVID as it was for polio. So this is an opportune time to sort of remind people that we've been through something like COVID before. We want to ensure that we reach our $50 million goal to fully leverage the Gates Foundation match. And just a reminder that DDF is matched 2-to-1 by the World Fund and then 2-to-1 again by the Gates Foundation. And of course, we need to begin immunizing children as soon as safely possible so that we can reach our goal of a polio-free world. And so I invite anyone to call on me at any time should they have any questions or require additional information. And there's one more slide. And this is just to say thank you for your time today. This is a picture of a little girl who has had her, she's been immunizing against polio, and we know that because she's had her pinky painted purple to indicate that she's been immunized, so that when the monitors go through the communities to check to see if kids have been immunized, they will know that she has been. So thanks very much. I'm happy to answer any questions that there might be.
Carol, thank you so much for being with us here today. It is just always exciting to be with you. There's a question in the chat pane that says, can you help me understand types of polio virus, 1, 2, etc.? Yeah, there are 3 types of the wild polio virus. And I always say it is very creatively named by the epidemiologists: type 1, type 2, and type 3. Type 1 is the most virulent. It's the type that causes the most paralysis. Type 2 was certified eradicated in 2015, and type 3 was certified eradicated just last year. So we only have 1 type of polio that continues to circulate in the world. Wonderful. Any other questions of Carol in the chat pane? Okay, Carol, thank you so much. We appreciate you being here. It's always a
Thank
pleasure
you.
to be with you. And Stephanie, I guess it's still me on the show here.
Well, I understand, Director David, that you have a very special announcement to share with all of us.
Okay, thank you, Stephanie. So the role of a director is to support the districts and support the clubs and set policy in the boardroom. And when this new world started up, Director Stephanie and Director Peter and myself said, what are we going to do to support our Rotary? And what are we going to do to engage our Rotary? So we started these sessions every week. They were intended, the full intent of these sessions were to engage Rotarians in our zones. 7:30 in the morning, repeated at noon Monday, that way hopefully maximizing the audience. We have about nearly 100 people on the call today. We had about 130 or 40 on Friday morning. But Stephanie and Peter and I feel that we met our objective. The objective was to get the clubs and get the districts out there and connected and engaged and hopefully push their momentum along. And each of us are sitting in on multiple Zoom calls with multiple areas every day of the week. But as of last Friday, we will not be having our Friday morning meeting anymore because we want to get out of the way and not be a deterrent to what's going on in our clubs and districts and be out there supporting them individually. So we've discontinued our Friday morning calls, and we will run this call through the 22nd of this month. And Stephanie's going to talk to you about the programs that we have lined up. Very exciting programs coming up the next 2 weeks. And then beginning in July, Directors Stephanie and Peter will be having a monthly call, a monthly Zoom call to talk about information and that type of thing. So thank you all for supporting us in our endeavor. We've had lots of participants in the hundreds every week, and we're grateful for that. Thank you for the opportunity to be with you. Back to you, Stephanie.
Okay, thanks, David, so much for sharing that with us. Let me just echo the comments to Carol. That was, again, a great presentation, Carol, and we appreciate it. Those of you on the call who have participated in a National Immunization Day have seen firsthand how that social mobilization gets the job done, because there are so many children that have to be immunized in one day. And that's our great legacy from our polio program, the social mobilization and how it can be effectively used for other reasons to help with global health and well-being. So thank you again, Carol, for a wonderful presentation. As David mentioned, we have some programs coming up in June that you will want to mark your calendar and be a part of. Next Monday, June the 8th, President-elect Holger Knack will be our special guest, and he's going to share information for all of us in zones 33, 34, and more. And then at the end of his presentation, he is going to have a special ceremony to install our DGEs from zone 33 and 34. So I hope you'll make some time to join us on June the 8th. The following Monday, on June the 15th, we have a special program with a NASA astronaut, Matthew Dominic. Matthew Dominic is part of the Artemis team, and that's the group that's going to be eventually going back to the moon and back to Mars. So this young man may be someone who someday walks on Mars. So I know you'll want to join us for that special program too. And finally, our last program, the Zoom program for this Rotary year, will be June the 22nd. And that's going to be a David, Stephanie, and Peter special. And to find out more, you're just going to have to tune in. Okay, Peter, now it's back to you. Peter, are you unmuted?
My goodness, my apologies. Thank you, Stephanie, and thank you for highlighting the program for the next 3 weeks. My thanks also to Carol and to Anne. We normally finish, as you know, by muting our phones and then joining with. So of all the things we think, say, and do, Is it
Is it the truth?
Is it
Is
fair
it
to
fair?
all
Fair to all concerned?
concerned?
Will it build
Goodwill and better friendships?
will
Will
it
it be
be
beneficial to all
all
concerned?
concerned?